Welcome to Coronavirus What You Need to Know. This is our 10th live town hall program in the series. These programs are produced in association with the Sonoma County Department of Emergency Management with input from public health agencies around the Bay Area and many nonprofit organizations as well. Good evening, I'm Darren Lachelle, President and CEO of Northern California Public Media.
And I'm Adia White, Assistant News Director at Northern California Public Media and your co-host for tonight's show. Coming up, we'll talk with Assembly members about the state's current financial position and capacity to support those in need. We'll also hear from a panel on equity about how the coronavirus is disproportionately impacting communities of color. Governor Newsom announced new rules to allow more businesses to reopen. We'll talk with County Health Officer Dr. Sundri Mace about what this means for Sonoma County. But first, Darren Lachelle has the details on how to submit your questions for tonight's town hall. Darren?
These town hall programs give you the opportunity to ask public health officials, medical professionals, and elected leaders the questions that are on your mind. You do that by visiting the easy-to-use contact form on our website, norcalpublicmedia.org/coronavirus. The contact form can be found on all the pages and news articles that deal with COVID-19 updates and information. Now, we've long followed the work of community organizer Ana Lugo, founder of Equity First Consulting. And late last week, Ana worked with news director Steve Mencher to put together a panel of Latinx leaders to talk about health and labor issues in the midst of our coronavirus crisis. We wanted to know how the pandemic was affecting communities of color in our county and the region. Now, there will be more about that later in the broadcast tonight. Ana was joined by Dr. Tony Ramirez, who works in a health clinic in Santa Rosa and also leads HPEACE, which stands for Health Professionals for Equality and Community Empowerment. The panel also includes Mara Ventura, Executive Director of the worker advocacy group North Bay Jobs with Justice.
There's been so much agitation lately from all sectors of the economy. People are anxious about reopening the economy, getting people back to work. And yet the getting the back to work, the fact that there are workers on the job right now who are the essential workers and then bringing more workers in, come with some possible problems. There are those who may fall sick when we get people back to work. This may not be something, again, that is equitable when folks start streaming back to work. So please tell me, in terms of your work with North Bay Jobs with Justice, how your organization is feeling about the pressure to get everyone back and working again.
Thanks, Steve. I think you said the right thing, which is the anxiety that workers are feeling. And I think understandably, because even as we've seen shelter in place and allowed some businesses to continue to stay open, there haven't been issues for workers addressed there. And so I think some of the anxiety of workers now returning to work is a fair question of, are the workers who are working now safe, and where is the confidence in my employer to ensure that I'll be safe when I come back to work? And, you know, as an organization, we're trying to, as much as possible, think about how we can insert that question into the discussions around the reopening, because as we understand in general, from the way that policies and power systems are structured, workers are oftentimes left without a voice at the table for these kinds of decisions. So it's been really important for us to insert the worker representation, worker voice, and worker organizations at the table with, for example, the County of Sonoma as they put together a task force on reopening. But even this task force doesn't include healthcare workers, something that we're trying to insert, and also has a ratio of 4 executives to 1 worker in particular, and with the emphasis on only particular industries. So I think one of the biggest things that have happened more recently that have been helpful is yesterday, Governor Gavin Newsom announced that workers' comp would be expanded to supporting any workers that are possibly contracting COVID-19 if they're working. That's going to be a huge step forward, and something that our statewide coalition of labor partners have been working on for several weeks now. He's also taken a good step forward around paid sick leave, but both what Governor Newsom's executive order have and what the Congress CARE Act provides is only paid sick leave for workers who are at employers of 500 employees or less. And as you can imagine, that takes out many corporations, many of which are still open. We have fast food restaurants, we have gas stations, we have places like Home Depot and Costco. So we really need to ensure that in the industries where we know at least 70% of our workforce are working, which are large employers, that has to include things like paid sick leave, PPE, and of course, access to being able to take care of themselves through things like SDI and workers' compensation.
All right, thank you very much for that. And that's a great reminder that, again, this all of the rollout of these new plans and protections is not always equitable. Let me read something about the American Civil Liberties Union, ACLU, that sent a letter 2 weeks ago. And it asked health departments and state officials across the country to collect and release aggregate race, ethnicity, and other demographic data of COVID-19 testing, infections, and deaths. And the letter also calls for the equitable distribution of personal protective and medical equipment. So I guess the question is, why is this data important? Do we have any data so far that suggests that the Latinx community is disproportionately affected by COVID-19? And that ties in with one of our viewer questions, which is, where are we with tracing and tracking to identify specific communities with the most occurrences? Dr. Ramirez, perhaps I'll ask you first what you've heard from other healthcare workers and what the experience has been so far in our community.
Yeah, and so primarily, why is this important? It's incredibly important when we're dealing with a virus that we still know little about. There's a lot that we have discovered, but there's still a lot of unknowns. And so this data is incredibly important for us to identify what communities are being impacted most and why. And not only is the data important, but it's about what questions we are asking. For instance, a lot of data is being explored through census data and data that looks at race and ethnicities that do not actually fully represent all of populations. And so important to recognize this because it is the same reasons of why we continue to see disproportionate healthcare outcomes in communities like African American community, Latino community that we're talking about today, Asian communities, Native Americans, because historically we have not done a good job of collecting data and thus not having an impetus to react and assure that we are looking at all the factors that could have come from it. So really an important opportunity to do so right now. I think unfortunately, for instance, locally Sonoma County has not released that data. We do have data from places like San Francisco and Santa Clara. And other places that we've seen, but if you think of California, trying to kind of extrapolate locally, we do see that in San Francisco, Latinos are disproportionately affected. And so the population of San Francisco of Latinos is about 15%, but yet those getting COVID infections are compromise about 25% of the confirmed cases. Same thing in Santa Clara, similar numbers. And what's important to recognize in terms of this data and information is that even if we didn't have this data and this information, what we do know is that historically pandemics hit the most vulnerable and marginalized population the hardest. And so we don't even really need this data right now. It's helpful for we accumulate it, but we know this as fact. And we know that this virus, in order to avoid it, you need to stay home, avoid large crowds, have access to cleaning supplies and good hygiene. That is not afforded to the poor, low-wage workers, unhoused, that are largely minority populations, speaking of Latinos, in this area too, of thinking of African-American population, the Asian population. And so just knowing that and adding on the layer of how these factors affect our health pre-virus, post-virus, we know that these communities are going to be largely impacted, both health, economic-wise. And so numbers are so important for us to be getting it. We do need to hold our officials accountable to be releasing this data and making it better, but also not necessarily waiting for the data to act, because we have plenty of information that we need right now to make sure that we are working on the things that Ana and Mara are talking about in terms of protecting the people that are mostly affected.
Anna, perhaps some more of the community input would be helpful at this time, so that you can share that with us and get some more responses as we wrap up here in the next 5 minutes or so.
Yeah, Steve, I think that as we wrap up in understanding that we got way more questions and concerns than we have time for, and truly, I think that to you and North Public Media's credit, Steve, you guys are really helping to provide a platform to answer these questions and answer these concerns in a way that can reach more and more of our community leaders who are then going into the community and doing work on the ground, right? So I think that since we did get so many questions and so many concerns really around, rents and wages and protections, I think people want to know that there is a safety net under many of our very vulnerable populations, right? That come July, we're not going to have a huge number of people experiencing homelessness because they couldn't afford to pay their rent. So I would ask Dr. Ramirez and Mara, what are some of the things you'd like our community to know and understand as we move forward into the recovery phase here in the county?
Community health centers all over are available to provide both mental health, physical health services to those that do not have a doctor, do not have insurance, and are undocumented. These visits without insurance are free. We do them over the phone to provide services and help brainstorm with individuals who are dealing with difficulties in regards to their health as it relates to the repercussions of the pandemic. And as we continue to move forward with reopening, wanting to recognize both to the workers and to our patients and to legislators that is really important to note that if you do not feel safe, that you reach out to organizations like Jobless Justice so that we can follow up with bosses that may or may not be providing adequate protections. And I also ask that local leaders and politicians just really, really, really focus on the current frontline workers right now. Because as we continue to move forward, I would say that we have yet to really make sure that our local frontline workers are very, very safe before we move forward. So that's the other thing that just kind of putting out there for our local leaders is that just they really need to prioritize that. Our current frontline workers, including farm workers, the undocumented, have not been fully addressed. And that really needs to make sure that we assure that as we move forward.
Okay, Mara, I guess we'll give you the last word.
No pressure. Yeah, I would say a few things. I mean, for one, I would say to folks to remember that ultimately this is about power. This is about how our current economic and political systems are structured, and nothing is conceded without action. And so it's so important that folks continue to raise their voices, continue to do exactly what folks like Dr. Ramirez and Anna are doing with talking to each other, raising these questions, accessing their elected officials, and most importantly, getting involved with organizations. North Bay Jobs of Justice is just one of many organizations, both locally and across the state and the nation, who are taking action. We heard from a nurse from Sonoma County that went out to New York City to go help in their hospitals. And of course, she had many insights and opinions about that process. But one of the most important that I took from what she told us as she came back with her reflections was how lucky she felt to have a union here in California as a nurse, because in the hospitals she went to where the situations were the most dire, they were workers working without a labor union and without a collective voice to have a seat at the table with higher up decisions being made. So just to say to folks that even in the most dire situation where our entire economy shuts down, some of you are continuing to work. You're essential. Even in the most extreme situation of an economic collapse, we still continue to need food. We still continue to need certain resources. And so it really shows how some of these workers are unfairly paid way too low, considering how incredibly essential they are. And there's a lot of power in that. There's a lot of more power than I think we always think about. So really encouraging workers to not only find access to organizations that will help navigate you through finding resources, but also to take action and use this as an opportunity, because anytime we come out of a crisis, it is an opportunity for us to think about how the structures impact us and where they work and don't work. So this is a really important opportunity. We have to continue to assert the conversation about how our communities are impacted by current structures.
Okay, well, thank you so much, Mara Ventura, North Bay Jobs with Justice, Dr. Tony Ramirez, and Ana Lugo. I really appreciate the opportunity to talk with all of you today and to share that with our listeners and viewers. Thanks a bunch, and let's do it again.
Thanks, Steve.
Thank you, everyone.
You can watch the unedited version of that conversation at norcalpublicmedia.org/Latinx. Now here in the studio with us, we have Sonoma County Health Officer Dr. Sundari Mase. Thank you so much for joining us again.
Yeah, thank you for having me.
So what are the latest numbers in Sonoma County?
Okay, for our update, currently, let me start with worldwide. We have almost 4.2 million cases and 286,000 deaths. In the United States, we have about 1.35 million cases, 80,000 deaths. And here in California, we now have 68,350 cases and nearly 2,800 deaths. In Sonoma, as of this morning, we had 314 cases, but I just want to let people know that we have added 20 cases, and that's the latest update. And I will look and see if they're in our contacts or not and let people know tomorrow. We do have 4 deaths. Another death was reported over the weekend. And a few other data points I think might be interesting for people is that we do have some race ethnicity data that we can discuss when we have questions afterwards. And we do know that people were interested in who had underlying medical conditions. And if you look at the data, the majority of those with underlying medical conditions, 65%, are in the over 65 age group, as we would expect. 30% of those 50 to 64 had underlying medical conditions, and 27% in the 18 to 49 age group, and 11% in our kids under 18.
So we've seen 4 deaths in the county now. Is that 4th one also over 65, as you mentioned earlier? For
yes,
the previous
all of
ones?
our deaths have occurred in people who are over 65, the most vulnerable population.
And do you expect we'll be able to learn more about those people at some point in the future?
Yeah, we'd like to look and see if they had underlying conditions, which we'll look at and report on that.
All right. So we now have race and ethnicity data. What does this show in Sonoma County? We've seen that nationwide, the virus is disproportionately impacting communities of color. What about in Sonoma County?
Yeah, we found that of our cases that reported the data, and I think the number that reported were about 230 out of the total number, 59% of cases are occurring in Hispanic Latino populations, 33% in white non-Hispanic populations, 5% in the Asian Pacific Islander non-Hispanic populations, and 3% in other non-Hispanic populations. But that actually translates into about 4 times more case rate in our Hispanic Latino population.
And do you have any thoughts on why that might be happening?
Yeah, I think that we might have some large clusters in family groups that could be driving some of that. But we're going to be looking into what are the other reasons why we're seeing this, because it is a little bit of a surprising finding.
Right. And what are your plans to start to address this disparity?
So we have a Latinx task force with community leaders that's been put together specifically to address this issue. And further, our nursing team that is going out and testing vulnerable populations is going to set up a drive-through or walk-up testing specifically for the Latino population this weekend. And we'll be giving a lot more information on where to go and how to get that testing. Again, it'll be free of charge and offered by the county.
Right, and I imagine some of this data might shift too as we expand testing and start to test more people?
I think so. Also, as we delve further into the data and we look at the different clusters, that might be helpful too in figuring out how many of these cases are all part of the same group, in other words.
Right. Well, is there anything else that you think people should understand about this demographic data and how it might be useful?
Yeah, that we need to direct our efforts at increased testing, specifically in populations that are more affected. That's why we're really reaching out and targeting testing specifically for the Latinx community now.
And we'll certainly be following up about that next week as well to see how that expanded testing goes. In other news, we have an amended parks order, so people will now be able to drive up to county regional parks, which we've all been very excited about. Can you tell us more about what the new order allows and does not allow?
Yeah, so we're opening up the parks for people to enjoy more. So people can drive now to inland parks and can enjoy such activities as tennis, golfing, boat launches. These are all part of the opening of the parks order. The coastal parks are still closed to people for driving in to visit them. However, people who are residents of the coastal areas can walk, bike, jog, anyway, get to the coastal parks and be there from 11 a.m. to 5 p.m. every day.
So there are some modified hours.
Yes.
Will that apply to regional parks as well?
Just for the coastal parks, yeah. And in fact, the reason for that then is that we really want to keep these parks for our county residents. And we thought this was a good way to first start off to ensure that people don't come and stay overnight and visit the parks and that sort of thing.
Right.
Yeah.
And last time you were on, you mentioned that you were evaluating how our initial soft opening went and whether or not that resulted in a spike in cases. Is it too soon to say whether or not that was the case yet?
I think it's a little too soon to say, but it is interesting that we did have 20 plus new cases today, and we haven't had a chance to catch up and see in whom those cases are happening, but we'll report back on that.
All right. And just to remind people, to keep social distancing while in parks. And do people have to wear their mask while in parks?
They should carry their facial covering. And if they feel that there's a lot of people and they can't adequately physically distance of 6 feet, then they should wear the facial coverings.
And most bathrooms, as you mentioned, are closed at this time.
Some restrooms will be open now. The ones that are smaller, our parks director has identified restrooms that can more safely be opened. And I just want to let people know that there is some new data out that suggests that the facial coverings can be quite effective in protecting the public, a publication that just came out. So we do have some data that says that maybe that's going to work. And so people should really try to go ahead and wear the facial covering whenever they can't social distance from people that they don't normally interact with.
Well, that's good news to hear.
Yeah.
So we do have a number of viewer questions regarding parks specifically. The first, people now appear to be complying with regulations in county parks. When will the county considering opening up the coast to people who don't live nearby?
Right, so we have already, as I said, opened up the coast for the residents of the coastal areas. So it's kind of a step-by-step basis that we're moving forward in. And so as we see how that goes, then we can consider the next step.
All right. Is there a possibility that youth sports can safely reopen in coming months?
That's a good question. Youth sports would mean lots of people together at the same time from not the same family, obviously. So there'll be some risk, definitely, in terms of the kids getting infected. But then that, as we know, although we have heard reports of some very serious illness of COVID that has been found in small kids and even teenagers. So that there's still a risk there, but I would be concerned then about potential transmission from the kids to older folks. So we're thinking about it, and I think the governor's plan is also considering youth summer camps, that kind of thing.
Were you referring to some of the cases we've seen out of New York that have had
Yeah.
some different symptoms?
Yeah.
Okay, but here we have not seen that, is that correct?
We don't have that many cases in kids. As you can see, it's 10% of our cases, and I don't know of any child who's been severely ill with COVID yet here in our county.
Right, well, I know a lot of people are really eager to hear whether or not their children will be able to do their regular activities this summer, so we look forward to hearing more about that. So we learned more about opening criteria today. Governor Newsom said that counties that meet specific criteria can begin to allow more businesses to open. Can you give us an update on what that will look like here in Sonoma County?
Yeah, so as you know, as of last Friday, retail businesses opened for curbside pickup and delivery, and I think that is actually going fairly well. Today, Governor Newsom did announce that the state is recommending opening dog grooming, dog walking outside museums, outdoor museums, and car washes. So that will be part of our next revision of our shelter in place, because as you know, we are aligning completely with the governor. Now, in order to move into phase 2, we have to meet certain criteria, and that's what the state has put out. That would include dine-in restaurants and other activities or businesses that are considered a little bit more high risk. So those criteria include not having more than one case per 10,000 population. That translates into 50 cases in the last 14 days. So not having more than one case per 10,000 in the last 14 days. We have had about 100, so we don't meet that criteria. The next criteria is not having any deaths in the past 14 days, and we've had 2 in the past 14 days. And the other criteria, we're actually doing better. We have to be able to test the amount that we said, 750 persons a day here in Sonoma County. And by next week, since we're adding 2 more lanes to our OptumServe sites, we'll be getting close to that. And I can go through the other criteria if that's helpful.
I think maybe we'll hit a few more, but before we move on, I'm curious. You said one of the criteria is based on the number of new cases we see, but as we increase testing, won't that also go up? So is that accounted for?
Yes, and in fact, I think that's exactly what the state wanted, because we haven't reached our peak of cases. And so the way that criteria is designed, as we test more, then if you have community transmission in your county, you're going to find more cases. And that's going to add to that statistic, that metric that is.
Okay, and moving on, you said, or moving back a little bit more, you mentioned that dog groomers can now open, and we've been hearing a lot from people who have car washes and dog groomers. I'm sure they'll be really excited to hear this news. What do they need to know to plan for reopening their businesses?
Yeah, so still we want to make sure that we're abiding by all of our recommendations to minimize transmission. So as we said, we have the physical distancing 6 feet apart whenever possible. If not possible, facial coverings to make sure there's lots of hygiene in terms of hand washing. I would suspect that if you are a dog groomer that you would wash your hands before and after you groom a pet, and that you ensure that you're observing the physical distancing from the owner of the pet, that sort of thing. And then for car washes, they ought to be cleaning their all of their machinery and services regularly to make sure that they minimize transmission. And then, of course, we have to have the ability to track people in those settings to see if we're finding more cases in those settings.
And if people want to know if their business is under the new criteria, where can they find out whether or not they'll be included?
Yeah, so pretty soon we'll be putting out all of our FAQs and the new order as well. In the next couple of days will be coming out. But they can go to the California CDPH website right now and the California State website to find the new criteria from the governor's office.
All right. So you mentioned that there are some additional criteria we'll need to meet before opening more businesses. What are some of those additional criteria?
Yeah, so we need to be able to have the hospital surge capacity for 35% increase in COVID cases. I think we're okay there. We also have our alternate care site still that's taking patients right now, both COVID positive and people who are under investigation or being housed there. We also would need to be able to have 15 contact tracers for every 100,000 population. We already are moving towards having 75 people involved with contact tracing, but we are actually trying to get 200 people in place trained for contact tracing in the next month or so. Then the ability to have the personal protective equipment, at least enough for all skilled nursing facilities for a 14-day supply and ongoing supply. So that's another important criteria that we are evaluating to see if we've met. And then we need to have best management practices as businesses reopen for the social distancing and all the other measures. And we've actually are getting those up on the website as well for different industry-specific guidelines.
We had at least 3 people write us and tell us that they want to volunteer and be contact tracers. Are you accepting volunteers at this time? Absolutely. So if you forward their emails to me, I will pass them on to our team that's doing contact tracing, and they'll be contacted to help. So please, if people are interested, you can be trained. The state of California is offering a training, and we've already sent 20 people to it this past week. Are those all people that have contacted your office, or is there a way that people can sign up? Yeah, so we are first going towards our volunteers, physicians and nurses that are retired that have been already involved with the contact tracing. But people can send emails in, and we'll definitely, I'll give you the correct email address, and then if people email, then we'll get them in to help. And anyone can volunteer? You don't have to have certain training or background? No. I think anybody can be trained for contact tracing. All right, well, we'll certainly be following up about how you can volunteer then. So the first viewer question we have this is about Newsom's criteria. So no deaths in 14 days. Is this a realistic criteria for reopening? Because it seems like deaths are not a direct correlation to the number of cases or spread of the virus.
Yeah, I think it's just one of the criteria that it kind of speaks towards protecting our vulnerable population, since the majority of deaths are occurring in people over 65 and those with underlying medical conditions. It's a way for us to track that. And for now, that is the criteria from the state. No deaths in the past 14 days.
Well, that makes a lot of sense, because if you have a population that might be older, skew older, then that would be an important thing to consider as well.
Right, and here in our county, as we've stated, 27% of our population falls into that high-risk category.
Right. So how is Sonoma County determining cause of death in COVID-19 cases? Do you cite the cause as COVID-19 even if they had another serious illness?
I think it would have to be somebody who's diagnosed with COVID and died from some complication that's consistent with COVID, a respiratory illness, maybe. It would be clear. It's determined by the physician, though, who does the death certificate. So we're really relying on the doctors in our community for the diagnosis and linking the death with COVID.
Right. The next question is, we've seen reports elsewhere in the country that COVID deaths from earlier on were underestimated. Do you anticipate that this is true in Sonoma County as well?
It could be. We know that Santa Clara found that they had a few deaths earlier, even in February. So we have gone back and we're considering testing some of the people that may have been at risk for COVID to see if they had it, just like Santa Clara County did. So we'll keep you updated on that.
How soon might we be able to have an update?
Yeah, I'm not sure, but I'll get back to you on that one.
Okay, we'll check in. So what is the best safety practice for people who go back to work, who come home to a household with at-risk people who haven't been leaving the house?
Yeah, so I think following all the measures that we talked about, first of all, people who are going to be going and working in businesses will be screened daily when they start their shift. We're putting in a plan whereby they do a symptom screen of their own. There's an app that we'll be using that we've created with IBM's help for people to screen themselves for symptoms, and then for employers to verify that they have screened temperature. And so that's happening daily anyways. But when people go home, they should make sure the hand washing and general hygiene measures, and ensure that if they feel ill at all, they need to go get tested right away.
Right, and then doing your best within the home, of course,
Exactly.
to keep your distance. So let's move on to our questions about testing. So you mentioned that we're working with the state to reach our goal of about 800 tests a day, and that we're close to meeting that goal. Tell me about the County Public Health Department's plans to expand your testing.
Right, so we are now testing 5 different groups. So we're still testing all healthcare workers who want to be tested, symptomatic or asymptomatic. First responders, again, asymptomatic or symptomatic. People over 65 that are symptomatic. People with underlying medical conditions of any age that are symptomatic. And then anybody who's working in our essential businesses. That would include, grocery clerks, people who are working in the court system, really all of the public works and county departments. Any workers now who are asymptomatic or symptomatic can come in for testing.
Wow, and any plans to move beyond that at this point?
At this time, I think we'll stick with the high priority, because OptumServe, 2 sites in Santa Rosa and in Petaluma, are going to be doubling their capacity as of May 18th, and they will be able to test 520 persons a day in these 2 sites. And they are taking anybody who wants to be tested. Even if you're asymptomatic in the community and simply want to test, you can get a test, and we have all that information on our website.
All right, moving on to the next viewer question. How many of the confirmed cases found with increased testing were in people who were completely asymptomatic?
Yeah, that's a very good question. We are looking at that, and we'll put up that information soon on our website at socoemergency.org, but that information is still being parsed out.
Okay. So now we have some questions about general safety. This person writes, there's been a lot of focus on reopening businesses, but my 10-year-old wants to know when she can see her friends in small groups, even in a mask.
Yeah, that's, we're not quite there yet, where we're expanding our interactions to people outside of the households, but it's a great question, and we'll keep you posted. And it also very much depends on how the governor's plan goes, since we still are under the executive order, and we're aligning with the executive order.
So we'll check it back in about that
We'll
as
check
well.
back on that one.
All right, so we're almost out of time here. Do you have anything else that you'd like to let people know?
Just thank you, everybody, for complying with the orders and the shelter in place. We know it's been really effective, and as we loosen up shelter in place, let's continue to be safe and follow all the practices that we put out.
All right, well, thank you so much again for joining us, Dr. Sundari Mase. We look forward to having you on next week as well.
Great, thank you.
And next up, we'll go back to Darren Lachelle, who would tell you how you can submit your questions to our newsroom. Darren?
Please share your questions with us so that we can get answers for you during these live town hall programs. Visit our easy-to-use contact form on our website at norcalpublicmedia.org/coronavirus. Fill in your question, share your name and your email, and select the subject of your question, and then click Submit. This program is being translated in Spanish live right now on La Mejor Radio 104.1 FM. We thank La Mejor Radio for their partnership on these town hall programs and for the service they provide to our community. Now, Sonoma County began to promote a new web portal this week called SoCo Launch. This will help Sonoma County businesses understand what they need to do to reopen. Susan Gorin, chair of the County Board of Supervisors, answered some specific questions from business owners as she talked with News Director Steve Mincher yesterday about how and when businesses can get back to work.
Susan Gorin, thanks so much for joining me today again.
Good morning, Steve.
Now, I had a question because we're getting so many of them from individual business owners, and it just depends on sort of the kind of business that they have. We have a question about someone who runs a car wash. We've had multiple questions about dog grooming. We have questions about people who'd like to get their Airbnb started up again, but they can't even feel like they can go a year out and get a weekend reservation from the Airbnb. So what are you telling as we get into these new phases? What are you telling the small business people about how and when the county's going to be reopening for business?
I think the county is telling you, we understand the economic imperative of reopening your business. You're struggling financially, as are so many in the county. And there are members of the board, myself included, who are advocating for reopening some of your businesses because they seem to be lower risk and the need is so great. And I've probably talked or written with many of you who just wrote those questions. So there are reasons why we are not reopening those businesses. They have to be in line with the governor's orders. They have to really implement the best practices that we are developing for your business sectors. We will get there. And I'm advocating for reopening, but we need to be safe when we do that.
Okay, and let me give you one specific example. Someone says, I have a small boutique fitness firm. People come one at a time into my firm, into my place, and we do exercises with them and so forth. Isn't that different from the big fitness places that are in those malls and the big box stores?
Absolutely, it's different, but it still is person-to-person contact, often with a sweaty-skinned person, sometimes breathing very closely. So are you going to be wearing masks? Are you going to be cleaning the equipment and your benches? Are you going to be 6 feet away from your client, or is it hands-on? All of those should be considered when you think about opening for even one person.
If you were to sit down with some of the demonstrators who have been showing up in Santa Rosa these last few weekends, and of course 6 feet away from them, with your masks on, both of you, and to have a discussion about what you'd like them to be thinking about. Can you share that with me? Can you share what that discussion would be from your point of view?
Well, I don't necessarily need to sit face to face because the emails that the supervisors are receiving reflect some of the sentiments. And I absolutely understand why people are frustrated and mourning the lives that we all shared just a few short weeks ago. But part of it is political philosophy, and I get that. Part of it is we have fewer cases here than in other counties. We should just open up more broadly. Well, one of the reasons why we have fewer cases and lower community transmission is because we have been pretty rigorous in sheltering in place. and closing down businesses and parks. And we do expect to see an uptick in our COVID cases as we've increased our testing. In a few weeks, our antibody test will be available, and then we can determine the spread of COVID throughout the community, probably a lot larger and wider than anybody anticipated. But I also have concern about looking at the age groupings. The seniors have stayed pretty much sheltered in place. We seem to be doing fine. The number of cases of children 0 to 17 is spiking, and that has me very concerned. Where are those young folks, our future, acquiring COVID? Is it through their parents or community transmission, playmates? And many people say, we just want the playgrounds to open up for our kids because they're going crazy. Boy, I get that. And as a grandmother of 2 toddlers, I understand the challenges that parents have in trying to keep their toddlers entertained and active with safe ways to do that. But we don't have the resources, and there are no groups yet willing to stand by a slide or a teeter-totter and wipe down the device every time after a child uses it. So be patient. We will get there. I'm enthusiastic that we will reopen soon, and we will be very creative in doing so.
Thank you so much, Susan Gorin, for joining me today.
Thank you. Be well, be safe, continue to shelter in place, and please wear your facial masks.
In anticipation of Governor Gavin Newsom's announcement that California would be moving into phase 2 of recovery, last week small businesses around the Bay began preparing to reopen. Many counties in the North Bay aligned with Newsom's plan. In the South Bay, however, it was a different story. South Bay reporter Pamela Lawrence has the details.
With California heading towards phase 2 of recovery, which would allow for a gradual reopening of lower-risk workplaces like some retail stores, San Mateo Health Officer Scott Morrow early last week told businesses in his county to start thinking of ways to safely reopen. For John Kavranian, owner of Nuts for Candy, a small toy shop in Burlingame, this seemed like good news. Kavranian is president of the Broadway Burlingame Merchants Association. The 100 or so merchant members look to him for information about the various health orders that affect their businesses. But by week's end, it was announced that San Mateo County, along with 5 other counties, would not be allowing non-essential businesses to reopen, not even for curbside pickup. Kavranian said the conflicting state and county orders caused confusion.
It's a big mess out there. Merchants are texting me, emailing me, calling me, saying, John, can we open? We hear one thing from the governor, then we hear other things from the social media and the news that several counties in Northern California are still extending the mandate, shelter-in-place mandate. So, and I've told them, if you're an essential business, you can open. If you're not an essential business, you have to wait until May 31st. They may even extend it, or they may even do it earlier than May 31st. Our last day was March 14th at the store, and we didn't want to take the risk. And also when we heard that essential business can open and non-essential, we thought we would be a non-essential. But we were told by our county 211 county hotline that if you sold essential products with a mix of non-essentials, you were able to open.
Kavranian reopened Nuts for Candy last week, adding more puzzles and educational products deemed essential. He closed again this week after a city council member told him he was misinformed, only adding to the confusion. Other retailers confused by the flurry of state and county announcements are finding ways to adapt their businesses. Christopher Diaz owns Potpourri, an artisan gift shop in Burlingame.
You hear these things on the news about what's happening for the state, but of course the county kind of supersedes the state. So we all thought that we could start curbside service, but in fact, the county of San Mateo hasn't allowed that yet. So we aren't able to do that.
So what have you done to adapt when you first had to close your physical store? Did you already have an online store set up, or did you quickly put one in place? Do you have one now? What have you done to stay afloat?
We are going to do an online website, but that takes a lot of time. And we're working on it now, and it's going to come, but we're still not there. So in the interim, we decided, well, what about Zoom? Because Zoom is this new thing that everybody's doing.
Diaz uses the Zoom conferencing app to take customers on a personalized virtual tour of his store. Since I hadn't gotten my mom a Mother's Day gift, I thought I'd see what that shopping experience was like. I wondered if this could be the future of retail.
I think a lot of people will feel that until maybe we get vaccination, until people feel confident being out and about, they're going to feel better about staying home or minimizing their exposure.
Mhm.
So to have options like Zoom, I think is going to be a tool that we can use for those that want it.
At Filoli Gardens in Woodside, CEO Karen Newport has adapted creatively, taking into account sometimes conflicting requirements. When San Mateo County gave the okay for parks and outdoor businesses to open, Newport consulted with county supervisors and the county health officer before making the decision to reopen this week.
We could have actually opened a little bit earlier, but Mother's Day is our busiest weekend. And what we knew is that we would have to really restrict attendance. And so we would have to turn too many people away. So we decided to set our opening day for May 11th.
And let's talk a little bit about the plan that you had to put into place. What changes have you made?
Obviously, our number one concern is is both our staff and our visitor safety. We are asking everyone to wear face coverings, so that's new and different. I know people have probably been doing it when they go to the grocery stores and things like that. And we're a little bit ahead of the curve. I know we were talking earlier. The governor's office is getting ready to release some new guidelines in their phase 2 with outdoor museums and other outdoor spaces. And so we're excited to be a little bit ahead of that curve and get to set the standard, I think, for the way these experiences happen in our new reality.
The City of Santa Rosa announced last week that the parking lot of the Finley Community Center will be repurposed as a temporary homeless encampment for between 70 to 140 people. The site will be run by Catholic Charities and will help support safe social distancing for those unhoused. Assistant News Director Adia White spoke with State Assembly members Mark Levine and Cecilia Aguiar Curry yesterday about what additional support the state can provide for unsheltered people in our community and other vulnerable populations.
It is about coalition building. And I think the legislative delegation from Sonoma County, the 5 of us, have been working tirelessly on many believe is an urban issue, homelessness, that it's something that happens in Skid Row in Los Angeles or in San Francisco's Tenderloin, some other areas. But we know that our neighbors can be homeless, and our neighbors need a roof over their head, need a way to get over a rough patch and find housing in the long term. We've seen this in particular throughout the North Bay, and Santa Rosa has been a flashpoint for that. Yeah. Our delegation has been able to help inform policy in a way that we've actually received grants to Sonoma County, totaling over $1 million. And this is just, I'm so grateful for my colleagues, because it's hard and painful to drive by the tents that have popped up on Highway 12, for example. It's a very, very challenging thing for us to do as individuals. I think that many of our community members become disheartened by this and almost disaffected and feel as though they're powerless to do anything to be helpful. We know that there are amazing nonprofits like St. Vincent de Paul and others that are really stepping up in that area, and the county is working in a way to be with a novel approach to dealing with this, and that we've been able to leverage these funds that the state has made available, particularly at this time of crisis, that the homeless population could be a vector for infectious disease like COVID is something that's very frightening. And we of course want to protect the homeless population, but by doing so, we really protect everybody in the community. Right. And it's just so important for us to keep a laser-like focus on making sure that we're able to support people during both a time of need, but this health crisis, because it's good for all of us.
And how will the over $1 million in funding be used in Sonoma County?
So the money is going to be determined by the county and the continuums of care that receive that money, but it's for housing. We really want to push people and support people as they get into housing so that they can do the distancing that they need to do during this time. But this was money that we needed all along. We always needed this money to help provide a roof over people's heads, to help them get into some form of security, safety, and to provide them some normalcy so that they can live their lives. This was always something that was morally right to do, but fortunately, we were able to seize upon this in the unfortunate circumstance of a health crisis to make sure that we're able to do the right thing, the ethical thing that we should be doing for members of our own community, and also, protect them and ourselves from COVID-19.
Can you both talk about what position the state of California is in right now financially? Assemblymember Aguiar-Curry.
Well,
I'll start with you.
Sure. I'll be more than happy to share what I know, and it's not rosy, it's not great. It's going to be a tough time. And being in a leadership role as we are, that we are going to have to take some hard knocks, but we want to keep at the forefront. And as the governor's told us before, that he really was acknowledging the fact that we need to keep our eyes on the ball of homelessness, COVID-19, and disaster preparedness. So all of those hit our district really, really well because we've had the fires. And then the last thing we want to know, what we're concerned about is having COVID-19 plus fires if indeed this happens this year. And we've allotted quite a bit of money for all of this going forward. But I will say it's going to be tough, and we're trying to find additional funds for counties and cities particularly. They have the most services that we all need, and right now, I believe it's this week, is our May revise comes out, and it's going to tell a lot. The governor's given us plenty of hints of how much we're in the deficit, and so we're all going to have to band together. We're going to have positive thinking, and we're going to have to think outside the box because we will be doing business differently.
I want to move on to some of our questions that we got on from the audience here. Assemblymember Aguiar-Curry, let's start with you. The first question is about testing in Lake County. When and where can I get a COVID-19 test in Lake County?
So the best thing to do is call the Lake County Department of Health. They are in charge of making sure where those testings will be done. They should be posting those on their local website, and you should be able to see those there. So I highly recommend tapping into those, as well as the Office of Emergency Services. I believe Sheriff Martin is in charge of that area, and he's been more than happy to help people in the past. But the Department of Health, by far, is where anybody throughout the state should hone in on and to take the time to look at their website.
So another viewer wrote, if rent owed is canceled or becomes non-collectible, will lawmakers make landlords whole on losses?
Whether you're a tenant where rent is due or a landlord and a mortgage is due, there is economic duress, financial burden shared by so many different people in California and across the country. And so right now, you cannot be evicted during the stay-at-home order, during the state of emergency, and that is a protection for all renters. If there are some legislative ideas of how to provide relief to people, it's unclear how they will find their way through the legislative process. It is unlikely, in my opinion, that there would be any state law that would waive rent that is due because someone in the end has a bill to pay. And so as much as we can do to find a way to give financial relief or time for people to get on their feet and have the banks, which they have been so far, been willing to delay payments on mortgages, that we will find a way to be as flexible as possible. It's a fascinating question because everyone is struggling with that, with the high rate of unemployment that we're experiencing in California and across the country.
So the last question is, When will Newsom's funding for undocumented workers be made available? And this was written in by someone who says they have 2 kids and need that funding to help take care of their children.
It's come to our attention that the dollar amount is not going to cover enough of our undocumented friends. And so the governor suggested public-private partnerships as doing some philanthropy and going to talk to some of our philanthropists throughout the state and the nation to help out. But again, I think we are kind of stymied, as the assembly member said, is that, until we see our budget and see where things are going, our hands are a little bit tied. So, stay tuned. It's going to be a rough road for all of us. We want our undocumented families as well to be taken care of because they are the fruit of our small businesses and our agricultural community, et cetera. And, again, it's going to really depend upon what comes out of this, the May revise in our budget.
We want to thank the Assembly members and all of our guests tonight for sharing information and resources during this program. We especially want to thank you for joining us for Coronavirus What You Need to Know. Remember, these live town hall specials are broadcast each Tuesday evening starting at 7 p.m. and air on KRCB TV, KPJK TV, and radio simulcast on KRCB FM Radio 91 with Spanish language live translation on La Mejor Radio 104.1 FM. The programs are also live streamed on Facebook Live, YouTube, and at norcalpublicmedia.org. Remember to share your questions for our next program by using our contact form at norcalpublicmedia.org/coronavirus. The contact form is displayed on every page of the website dealing with the coronavirus outbreak in the Bay Area. On the page, you'll also find the frequently asked questions sections where the answer to many of your questions may already be shared. So please remember to visit us at norcalpublicmedia.org/coronavirus for all the news and information that you need. Now, when you're on the website, you also see a very special section under Education. So KRCB, KPJK, and all of California's public television stations have come together to create what we're calling at-home learning. So teachers, parents, homeschoolers, educators, preschoolers, they're all using this wonderful new resource called Learn at Home from California's public television stations. So check that out now, and thanks for joining us. I'm Darren Lashelle with Adia White for NorCal Public Media. Good night.
You're watching Northern California Public Media, made possible by viewers like you.